What is the future of lung cancer in Japan? That is what we're going to be going over in today's video, where I'm going to talk about the latest research from 2022 to early 2023 and clinical implications on smoking-associated lung cancer. So these are the points that we're going to be touching on today. The first being, have smoking cessation and early screening initiatives in Japan actually worked? Second, what does the latest research in this population say about smoking cessation before surgery? And then finally, what potential biomarkers have been recently identified in this population? Now, starting with the first point, this study from Nguyen et al. Looked at data from three different cancer registries across Japan from 1993 to 2015 to look at what the trends were in lung cancer incidence. And these graphs, which are from that paper, are looking at specifically lung cancer by stage. And they were interested in looking at localized versus regional versus distant. And so regional and distant being like an increased propagation of the cancer, whether it's through the different lobes of the lung or even to other organs within the body through metastasis. And you'll notice that the top E and F versus the bottom G and H say before versus after amputation. And what the authors did is they took some of the values for which there was missing data and they imputed, for example, the information regarding stage and the information regarding histology, which we'll talk about in the next slide. However, you're able to see that the trends are somewhat similar, whether it's before or after amputation. And what they found is that localized cancer was increasing over the period with an average annual 3 to 5% increase for males versus females versus a 2% decrease in regional cancer. Here we can see the trends in different histology types of lung cancer over the same period for males and females. And we're seeing this slight decrease in squamous cell carcinoma, which is the yellow line, especially for males, an average annual 1% decrease versus like pretty much unchanged in females. So, what do these trends actually suggest? Well, they imply that the cancer control efforts that have been ongoing in Japan over that time period have yielded positive results. So, increased early diagnosis of cancer due to nationwide screening efforts. And the authors do mention that the decrease in squamous cell carcinoma is most likely due to reduced smoking prevalence in Japan, which was especially marked from 1965 to 2018 among Japanese men. And it was seen that the rates of smoking among men decreased from 82% to 28% over this time period, which is quite a lot. Now let's move on to pre-operative smoking cessation. So there is a growing consensus that stopping smoking pretty much for 6 to 8 weeks is what is recommended before surgery, can have a significant positive benefit to patients in terms of their outcomes and having lower complication rates. And so, this recent research in 2022 that was done in Japan highly supports the benefits of quitting smoking prior to surgery. So, there are a couple studies that talked about this, and I'll start with this first one, which is a retrospective cohort study. So that means that they were looking at data from a cohort of individuals. In this case, it was at a specific hospital in Tokyo, and they were assessing the complication rates after surgery. So from 2011 to 2020, the complication rate was significantly lower in patients who stopped smoking for greater than 2 months before surgery compared to those who quit within 2 months. So this is kind of interesting because, as I mentioned, the typical guidelines are for patients to quit for between 6 to 8 weeks before surgery. And so this study is showing that if you can quit even earlier than that, then there is a significant benefit. A similar study was conducted from 2014 to 2017 And that one reported that smokers had a five-fold increase in post-operative complications compared to non-smokers. As you can tell, that's quite a lot, right, in terms of your risk of having some kind of a complication after surgery. However, they noted that low pulmonary function was more strongly associated with complications than necessarily the duration of preoperative smoking cessation. So this is helpful to note, I would say, for clinicians because it kind of underlies the mechanism by which smoking may increase the risk of complications, right? So really, the mediating factor may be the lower pulmonary function, and so that's something that is important to note because different patients may smoke, but then may have various pulmonary function changes that are associated. So what I'm trying to say is that two patients may smoke the same amount, but one may have significantly lower pulmonary function and therefore may have significantly worse outcomes after surgery compared to the other patient. And finally, this study in the National Cancer Database of Japan from 2014 to 2016 found that post-operative mortality and pulmonary complications increased with smoking status, especially among heavy smokers compared to non-smokers. So really just underlining the fact that it is super helpful for patients to even temporarily quit smoking before surgery so that they have a decreased risk of these potentially life-threatening complications. And now kind of getting on to some more novel research and future trends to be looking at when it comes to lung cancer, specifically here in the Japanese population. So this study by Suboy et al. Looked at aryl hydrocarbon receptor repressor DNA hypomethylation. And so the significance of this marker is that the aryl hydrocarbon receptor pathway, which is AHR pathway or AHR signaling, has been implicated to be involved in cancer development. And now, what's interesting with that is that the research is, I would say, like newer and also it's somewhat mixed. So we'll talk about that a little bit more. But in this case, we're looking at if we have lower or higher levels of methylation of the aryl hydrocarbon receptor repressor, how does that affect lung cancer risk? And so the significance of that is that when the repressor is less methylated, that means it will be able to repress more, right? So it'll be able to repress AHR signaling more. And so this study looked at 812 participants in the Yakumo cohort study, and they were followed from 1990 to 2019 with a median follow-up of 27.8 years. And that is important to note because cancer is something that develops over time and it can take decades to develop. So knowing that the median follow-up is 27.8 years is that's quite reasonable to be assessing cancer risk and cancer mortality specifically in this case. So what the authors found is that the risk of all cancer mortality was significantly higher in the first quartile of AHRR DNA methylation compared to the fourth quartile. So that means that if a patient had AHRR DNA that was less methylated and therefore was repressing AHR signaling more, we were seeing that their outcomes were worse compared to people who had much more methylated DNA. And in terms of lung cancer mortality, the significance were borderline. One potential explanation for this could be lower power because obviously they have 812 participants, which would have different kinds of cancers. Lung cancer would be one of them, and so depending on the size of the sample for lung cancer, that can potentially lead to borderline results. But just important to keep in mind that it is in fact like the confidence intervals include like a decreased risk as well. So what does this research actually mean with these like very complicated names and all of that? As I mentioned, it's really important to note that the research on the role of the AHR pathway in lung cancer is early and that the results are also mixed. So some studies have found upregulation to be associated with increased incidence of cancer, so an increased chance of getting cancer, while others have found downregulation to be associated with greater mortality, so a greater chance of people who have cancer than dying. And so that is what was found with this study. So another kind of novel biomarker, and this one is looking specifically at patients who underwent surgical resection and their likelihood of recurrence after resection. So this ties in really nicely with what we were talking about regarding pre-op smoking cessation and outcomes after surgery. So in this study, which was a small study, you can see that they had 26 patients with adenocarcinoma and they had 18 patients with squamous cell carcinoma. And what they did is they took biopsies and they measured these lipid levels. And then they saw over time this was actually a case control study, but they compared the recurrence-free period for patients who had these different lipid levels. So for patients who had higher levels of these 3 phosphatidylcholine isomers, that was actually associated with a shorter recurrence-free period among patients with adenocarcinoma. And then similarly for this lipid level, which I will not even attempt to say the name here, but this specific lipid that they were tracking was associated with a shorter recurrence-free period among patients with squamous cell carcinoma. So obviously this is very early research, but I think that it does potentially warrant further investigation in terms of whether these lipid levels could be good markers for recurrence at an earlier stage after resection. Now, I just wanted to close with kind of summarizing our final points on what is really the future of lung cancer in Japan. So looking at the trends leading up to today, national screening and smoking cessation efforts have led to earlier diagnosis, and a modest decrease in squamous cell carcinoma incidence is what was supported by the first study that we looked at. Additionally, there are multiple recent studies in Japan that have validated the benefits of smoking cessation prior to lung cancer surgery to improve post-operative outcomes in the Japanese population. And then third and fourth, kind of looking at these new potentially useful biomarkers, looking at hypomethylation of the AHRR DNA. That may be associated with higher cancer mortality rates among Japanese patients. And we've seen that there are some other studies that have found similar results, but we are also seeing that upregulation of the AHR pathway may be associated with increased incidence. So that really needs to be explored further to understand whether, is this all noise or is this really something substantive that's going on? And then finally, further research may be warranted into lipid biomarkers that are associated with increased lung cancer recurrence. And this is very early stage research. So thank you everyone for watching and making it to the end of the video. I hope this was informative for you all and looking forward to seeing you all soon again. All right, bye. So metastasized cancer. It still shows you crawling. What?